Good morning, ladies and gentlemen. Thank you for this opportunity to present the findings of our study that was done among children that had acute pain in Nigeria when they were given oral Arginine. My name is Richard Onalo. Sickle cell disease is a chronic hematological condition associated with chronic hemolysis and exacerbation of symptoms known as crisis. Various forms of crisis are known, but the commonest of this crisis is the vaso-occlusive crisis, in which the hallmark is pain. This pain has been said to be excruciating, worse than labor pain. In patients that have sickle cell disease, the arginine level, which is an amino acid, is low in them. This arginine level is further depleted when they have crisis. Incidentally, arginine is a nutritional supplement that can be purchased over the counter. Arginine is a molecule that is used in the production of a nitric oxide, the potent blood vessel relaxer in the body. As a result of the finding that arginine is deficient in sickle cell disease individual, some authors have used these amino acids in the treatment of some patients. For example, patients with chronic leg ulcers, patients with priapism, patients with increased pulmonary hypertension. Arginine has been used in them, and it has been found useful in relieving their symptoms. It was also shown that arginine can increase the mitochondrial functions of cell and as well decrease the oxidative stress in patients with vaso-occlusive crisis. Recently, Morris et al. Did show that following intravenous use of arginine, patients with sickle cell vaso-occlusive crisis had a reduction in their total parenteral opioid requirement by at least 54%. These observations, along with the lack of a study in Africa on the use of arginine in sickle cell patients, motivated us in developing this study. More so, we are also interested in finding a molecule that can be used easily by the patient at home and also can be administered by themselves. So we developed this study to determine the role of oral arginine in the management of children with sickle cell disease admitted for vaso-occlusive crisis in Nigeria. The study was a double-blind, placebo-controlled phase 2 trial conducted in 2 major hospitals in the Federal Capital Territory of Nigeria. A pure brand of arginine hydrochloride was used, procured from Ajinomoto, USA. Blood samples were taken from the patient prior to administration of the molecule and also after at the conclusion of the study. Patients enrolled were at least 5 years of age. They were admitted for vaso-occlusive crisis with severe pain with a pain score of at least 7 on a scale of 0 to 10. Our primary outcome was the total analgesic medication used in this patient, and this total analgesic medication was quantified using medication quantification scale as developed by Stedman in 1992 and adapted for use in children with sickle cell by Jacob in 2007. Other outcome variables are changes in pain score, time to crisis resolution, and total length of hospital stay. 68 patients were recruited, almost half on each arm. The baseline characteristics of these patients were essentially similar. The study found that following administration of oral arginine, the plasma arginine level increased by a mean of 125% in the arginine arm compared to the placebo arm, and this is statistically significant. Also, the global arginine bioavailability ratio is also increased by 59% in the arginine arm. The study also found that there's at least a 39% reduction in the total analgesic required for the control of pain in patients that had arginine along with the conventional analgesia compared to the placebo arm. And the box plots box plot, the box plot and whisker is showing the much difference between the analgesic requirement in the Arginine arm compared to the placebo arm. Clinically, the patient on the Agni arm tend to have a faster resolution in their pain score, as this graph is showing here. The blue line is the Arginine, while the red is the placebo arm. It was also found that oral Arginine impacts significantly on the time to crisis resolution. That 25% of our patients on Arginine arm achieve crisis resolution in about 72 hours, as compared to the same proportion achieving the same in about 120 hours, such that by day 5, 54% of patients on Arginine were already home, as against of just 24% in the placebo arm. This was found to be both clinically and statistically significant. The length of hospital stay was also found to be shorter in patients that received Arginine compared to the placebo. It was found that the mean length of stay in the patient that had Arginine was 110 hours compared to 156 hours in the placebo arm. And there was a difference of 46 hours between those that use Arginine and those that use placebo. In conclusion, Arginine deficiency plays an important role in the sickle cell vaso-occlusive crisis. Use of oral Arginine along with conventional analgesia is superior in pain control than the use of analgesics alone. Oral Arginine increases the rate of pain reduction, enhances early achievement of analgesia, reduces opioid and NSAIDs use, is generally a safe nutritional supplement, shortens time to crisis resolution, and reduces length of hospital stay. With this, we recommend a phase 3 multicenter clinical trial. Thank you.